Oh, it didn't do the 3, 2, 1. Sorry. Go ahead.
Say hello, everyone. Welcome to the Nathan Lee Foundation for Patient Advocacy. We're proud to announce our first podcast series, Understanding Your Blood Work. First video we're going to have is CBC Decoded. Have you ever got a CBC? I think everybody has gotten a CBC over their lifetime, from a baby to an elderly person, to a senior adult. Everyone has had at one time or another CBC. You ever wonder what all those tests mean? Well, I'd like to introduce Nancy Rector. She's going to give us an overview on CBC's Decoded. Nancy?
Hey, everybody. I'm Nancy Rector. I'm a medical technologist and a clinical microbiologist. And I'm going to decode this for you. We're going to do this in 2 parts. One is just the CBC, and then there's sometimes another half to it. But I'm going to bring up what a typical report looks like, and you can usually get this on my chart. And you can see the yellow areas are outside of the normal range, and the green areas are you're good to go. And what I'm going to start with is the white blood cell count. And the CBCs are always done to look at your overall health. And it will identify anemias. It will identify types of infections, give the doctor an idea of if you have an infection, what's causing it in general terms. So the white blood cell count, or the WBC, it measures the total number of white blood cells. And it's usually around 4,000 to 11,000 cells per microliter. So you're going to see, the one you see is right in the middle there, maybe on the higher end. Those white blood cells indicate infection or lack of infection. So the one you see up there shows no infection. The next parameter is the red blood cell. And the red blood cells, or the RBCs, measure the total number of red blood cells in, again, it's per microliter. Normal range is about 4.5 to 5.9 million cells for men, and 4.1 to 5.1 billion cells per microliter for women. So there's a difference between men and women, and typically your result, depending on where you sit, is going to just reflect that. What you're looking up there is mine, and it reflects the results for a woman. Within the red blood cell count, one of the other parameters that you're going to see is hemoglobin. So hemoglobin, or HGB, or HB, measures the amount of hemoglobin, which is the oxygen-carrying protein in your red blood cell. So it's the part of the red blood cell that carries oxygen to your brain and from your lungs to your brain. The normal range is 13.8 to 17.2 for men. And for women, it's 12.1 to 15.1. And that's grams per deciliter. It doesn't, the deciliter and microliters really don't matter when you're looking at this. You just want to know where you sit. The hematocrit, or HCT, it measures the proportion of blood volume that's occupied by red blood cells. So if you look at, and I'll throw a picture up here of a hematocrit, a manual hematocrit, you can see the white blood cells are the white part. You can see what part is red, and it's a proportion of your overall blood volume. Again, the normal range for men is higher. It's 38.3 to around 48.6%. And for women, it's 35.5 to 44.9% of the overall blood volume. You also have something called MCV, which is, and amazes me that it's not on the lab report that I had up there. It just says MCV, and who knows what that is? Mean corpuscular volume. That's a mouthful. It measures the average size of red blood cells. So normal range is around 80 to 100 femtoliters. Don't worry about what a femtoliter is. It's not relevant. It measures the average amount of hemoglobin in the red cell. Normal range, 27 to 31 picograms per cell. So an example, if you're anemic, sometimes the MCH is going to be higher because your body's trying to get the red cells might be low, and it's trying to get the maximum amount of oxygen carrying capabilities. It also could be low in anemia because you're at the beginning, because your body's just not kicking out the hemoglobin. There's also another one there, MCHC, which is the mean corpuscular hemoglobin concentration. So it's that hemoglobin, but in a percent, like what percent of the cell. Normal range is 32 to 36 grams per deciliter. The next thing that you're going to look at is a red cell distribution, or RDW. It measures the variation in size of red blood cells. Normal range is about 11.5 to 14.5. So blood cells in different health anomalies can change sizes. As a matter of fact, like something typical sickle cell anemia, the cells actually sickle, they turn into they curve. I can put a quick picture up here for you. That would completely change the red cell distribution and give the doctor a heads up that there's something that's not right. You also have platelets, and they're also called thrombocytes. It measures the number of platelets in a volume of blood, and platelets are important for blood coagulation. Normal range is about 150,000 to 450,000 platelets per microliter. There's MPV, which is mean platelet volume, and that measures the average size of platelets. And again, different anomalies can cause platelets to be larger or smaller, and this gives the doctor an idea of what additional tests to do looking forward if there's a problem. So it measures the average size of platelets. The normal range is about 7.5 to 11.5 femtoliters. Platelets can be, their stickiness is very important in the initial blood coagulation process. The blood coagulation, and we can possibly talk about this at another time, is a cascade of several different factors that ultimately control how you bleed or don't bleed. Additional parameters that are in that original count is a reticulocyte count, and that measures the number of young red blood cells. It can indicate bone marrow activity. So if you have a lot of reticulocytes, that means your bone marrow is working hard to produce red blood cells, possibly in anemia where your body's trying to catch up. Again, these parameters actually give the doctor an overview of your health, but it also lets them know if there's a problem and where to go from here. And this is where, there's one more set of parameters that we'll talk about next time, and that's the white blood cells and breaking down the individual white blood cells to different types to actually drill down into what's causing an infection. And that's it for the first part of CBC Decoded.
May I ask a question?
Oh, you have a question? All right, go ahead.
Sure. What happens if your blood counts are outside the range? And I don't mean on the fringe, because could be margin of error, standard deviation could be margin of error on the test. But if they're in immensely on one side or on the other, should the patient or a caregiver for that patient be concerned? And what would their next steps be? I'm sure their doctor would be contacting them.
If they're extremely out, If they're out a little bit, I mean, it could be just a transient situation. But if they're out a lot, like if it's a really, really high white blood count, they've got to find out why. So but that's originally, that's what this is for. This is to give that indicator. So where do we go next with what's happening? Or we didn't know something was happening, and wow, all of a sudden we do. It allows us to see the next steps. And when I go through the white blood cell, the differential, it's called the differential because it differentiates between the white blood cells. I'll go into a little bit more of that where, you know, what does it mean when there's a high white count and some of those individual types of blood cells are off or too high. We'll do that next time. Good question, though. Any more?
Thank you, Nancy. No, that was great. Thank you.
All right. Well, I want everybody to like us, subscribe to our channel, and share it with your friends who might want to learn how to interpret their lab tests. Have a great day.